my pleasure to introduce Dr. Tomoko Makishima from University of Texas Medical Branch, Galveston, Texas. Dr. Makishima received her medical degree and PhD from Kyushu University School of Medicine, Fukuoka, Japan. She completed her residency and clinical fellowship at the Department of Otolaryngology at Kyushu University Medical Hospital, as well as her clinical fellowship. She's board certified by the Otolaryngological Society of Japan. She joined the University of Texas Medical Branch in 2005 and currently serves as an associate professor in Department of Otolaryngology Head and Neck Surgery. Her research is focused on understanding molecular mechanisms of hearing and balance disorders. Particular focus that her lab has is working on characterizing hearing loss and balance dysfunction caused by Lassa virus in mouse models as well as human subjects. Dr. Makishima, thanks again for joining us, and we are looking forward to your talk.
Thank you for the introduction. I'm really happy to be here. For those of you who don't know where University of Texas Medical Branch is, we are in Texas in a very small island on the Gulf, and I will stop at the Gulf and not mention where the Gulf is. But anyway, today I'll be talking about the project that we have been working on for the past 10 years about hearing loss. Oh, sorry, it's a spelling mistake on the title. Hearing loss induced by Lassa fever. So let me start by explaining what Lassa fever is. I'm sure a lot of you do not know Lassa fever. This is an endemic hemorrhagic fever in the western part of Africa. The acute hemorrhagic fever is caused by infection with Lassa virus. The countries that are affected by this Lassa fever, Lassa virus infection is Benin, Ghana, Liberia, Mali, Sierra Leone, and Nigeria. The host for this virus is a rat that is endemic to this region, the Mastomus natalensis, and the rat does not live anywhere else in the world, and so that's why this disease is only in this region. The fatality rate of this disease is about 1%. However, there is estimated about up to 400,000 cases per year just in this region. There is an antiviral that is effective if it is applied to the patient within 5 days of onset. But most importantly, what is very interesting to us as otolaryngologists is that about 25 to 30% of these patients who are infected with the virus eventually develop hearing loss. Incubation time of this virus is about 6 to 21 days. And again, symptoms vary. Most people just clear it like a mild cold. But then if you're unlucky and if it develops all the way into hemorrhagic fever, the fatality rate can be 20 to 40%. Death usually occurs within 14 days if you develop into those hemorrhagic states. There are diagnostics, but because of the medical infrastructure within these Western African countries, it is a challenge just for diagnosing this disease. Treatment, again, is antiviral ribavirin, and to date, there is no effective vaccine. And the interesting thing about the hearing loss that develops within these survivors is that it develops at the convalescent phase after the patient clears the acute phase of the disease. And usually the hearing loss is sudden onset after several months, and then the degree is severe. Oftentimes it is bilateral. The reason why I am studying this disease is that at UTMB, we have this place called the Galveston National Lab. It's national, but it is located within UTMB. And a lot of the scientists there study diseases that are infectious, mostly at the BSL-4, biosafety level 4, which is a very dangerous pathogen, and such as Ebola virus. And Lassa virus is also within that category of BSL-4. But in any case, my collaborator, Dr. Passler, pictured here, was interested in studying the Lassa fever and Lassa virus, and they developed a mouse model. And this mouse model actually is a STAT1 deficient mouse that is infected with the Lassa virus that was isolated from human patients. And interestingly, this mouse model does reproduce all of the symptoms that the humans present. And also important to us is that 100% of these mice also develop hearing loss. And so we decided to team up and then look further into the hearing loss aspect of this disease, because it is affecting a lot of the patients in Africa. And this is just to show a comparison of what humans and STAT1 knockout mice, when they're infected with the virus, present as symptoms. Mortality rate is about 1 to 10%. They have fever, hemorrhage, weight loss, hepatitis. And as of hearing loss, the prevalence of the humans is about 30%, but in our model, it's about 100%. They have sudden onset. Most of the mice are, of course, bilateral. Humans are also bilateral. The degree of the hearing loss is about the same. In the humans, unfortunately, because of the medical infrastructure, we don't have autopsy results or anything to show what the pathology is in the inner ear. But for our mouse models, we do have a pretty detailed histological study going on, and I will be presenting that later on. So why do we want to study hearing loss caused by Lassa fever when it's not prevalent in the United States or any other place in the world? Well, there is actually no viral infection-induced hearing loss that can reproduce hearing loss at a high level like this. So this is sort of an ideal model to just generally study viral infection-induced hearing loss. And also, because of the similarity with the sudden onset, maybe a subset of the sudden sensory neural hearing loss that we see within the United States may have a similar mechanism if it is caused by viral infections. And to this audience, I really don't need to repeat what sudden sensory neural hearing loss is. But as everyone knows, some of it might be infectious and then some of it might be immunologic. And those are the targets that we are looking for in our Lassa fever model. So we started off by doing a simple pilot study using STAT1 mice and also interferon alpha beta gamma receptor knockout mice. The difference between these two mice are that the STAT1 knockout mice are a partial immune response model, whereas the interferon mice are completely deplete of any immune response. And what we did was that first we did a baseline auditory test. After that, we put the mice in the ABSL4 environment and then infected with the Lassa virus. And after 60 days, we euthanized them. And then, before that, we did an auditory test and then looked at the inner ear histology. With this pilot study, because we didn't have the ABR and DPOE set up within the ABSL4, we just did a simple auditory startle reflex. And as you can see down here with the STAT1 knockout, which is a partial immune knockdown, you see that this is day 29, day 45, and day 59. After 2 months, you can see that the hearing has changed in these STAT1 knockout mice, whereas in the interferon, these mice are completely depleted with immunologic response, and these mice did not develop hearing loss. We looked at the inner ear histology, and this is a simple H&E staining. On the left panel, you see the STAT1 knockout mice. In the right side, you see the interferon alpha, beta, gamma receptor knockout. And this is a cross-section of the one of the cochlear ducts, and also you can see the facial nerve right next to it. This is the organ of Corti. If you look at the STAT1 knockout, what you notice is that the spiral ganglion and the cochlear nerve, the cell population is very sparse compared to the interferon knockout mice, where you see the neuronal structures that are still very dense and healthy looking. And you also see a lot of lymphocytes and neutrophils filling in the spaces. We also looked at the CD3 antibody. This is a T-cell lymphocyte marker. And left-hand side again is the STAT1 knockout. The right side is the interferon alpha, beta, gamma knockout. We see a lot of the T-cell T lymphocytes infiltrated in the scala tympani, also around the spiral ganglion and the cochlear nerve. In the interferon alpha, beta, gamma knockout, excuse me, you still see the CD3 staining, the lymphocytes within those structures, but not as bad as the STAT1 knockouts. We also located the Lassa virus antigen within the cochlea. Again, we see the Lassa virus within vascular-rich structures, such as the spiral limbus and the stria vascularis in the STAT1. And then in the lower panel, you see the interferon alpha, beta, gamma knockout, also located in similar places as the STAT1. But again, even though the virus is there, there's very less destruction within the complete immunologic knockout of the interferon alpha, beta, gamma knockout mice. So in summary, for this pilot study, we found that the Lassa fever model mouse reproduces the human Lassa fever symptoms, including hearing loss, which happens to be very ideal for us to study further. Pathological changes in the inner ear were damage to the cochlea and vestibular systems. We could see hemorrhagic changes in vascular-rich tissue. Interestingly, the sensory hair cells were intact. We saw nerve damage to the 8th nerve, but not so much in the 7th nerve. Also, Lassa virus and the CD3 positive T lymphocytes were observed around the same area as we saw the damages. And it does look like, based on the comparison between STAT1 and the interferon knockout mice, that immunologic response is necessary for inducing hearing loss. So now we took this study a little further. This is study number 2 that we did. We depleted either CD4, CD8, or CD4 and CD8 both, or did nothing. And repeated sort of the same experiment. We did a baseline auditory test, put them in ABSL4 infected with Lassa virus, did auditory testing serially, weekly, and then euthanized them at around 3 months of age. And these are the results for that experiment. We have 5 different groups that we compared. The blue is the CD4 and CD8 double knockout. Red is CD4 knockout, and green is CD8 knockout. Purple is sort of an isotype control just with IgG. And then the black is uninfected. As you can see, with the weight change in the body temperature, most of the severe disease occurs within about 10 to 14 days. These are days post-infection right here. And then if you look at the survival, the red, which is the CD4 depleted group, you can see that a lot of the mice died within the acute phase. The purple is the isotype control, and of course, a lot of them also did not survive. But all of the other ones, the CD4, CD8 double knockout, and CD8 knockout, all survived. And we also looked at the hearing loss, whether it correlated with the survival or the disease degree. The left-hand graph is the results of the ABR, and the right-hand side is otoacoustic emissions. The green is the anti-CD8, CD8 depletion, and again, the red is the CD4 depletion. If you look at the results, it does look like now that compared to this one, if you can remember, it was the CD4 depletion that didn't survive, but the ones that survived did not develop hearing loss. But instead, if you depleted CD8, most of them did develop hearing loss, and we started recording the auditory function at 4 weeks post-infection and every 2 weeks thereafter. And you can see that around 4 weeks is where the hearing loss develops. Unfortunately, we were not able to record anything earlier than 4 weeks, and that is because if you look at this, the weight change in body temperature, the mice were really weak during the acute phase, and if we were to do ABR and DPOAE, of course, we'll have to anesthetize them. We feared that if we did that, they would all die. So that's why we started at 4 weeks. But in any case, we also looked at the histology, and this is after 3 months. The left panel right here is the control animals with PBS infection. And then on the right-hand side is the one with Lassa virus, CD8 depleted, the ones that developed hearing loss. And you can see a striking difference between the control and the ones that were infected with Lassa virus. Again, we see a lot of the infiltrate within the scala tympani area, a lot of the neutrophils and lymphocytes. Also, a lot of hemorrhage and degeneration within the spiral ganglion and the cochlear nerve. But if you look at the CD4 depleted or the CD4 and CD8 depleted animals, we don't see that change. looking at also where the Lassa virus is located within these animals. On the left-hand side is the CD8 depleted with Lassa infection. The right side is the isotype control. Both showed hearing loss, and of course, you see the same change within the spiral ganglion. You see all the degeneration of the cells, infiltrates in the scala tympani, and the Lassa virus also located within the same region. And so is the CD3 positive T lymphocytes. So these are all paraffin section slides that we looked at with 2D, two-dimensional slides. But we were also interested in seeing what the whole picture was within the inner ear. So we use this technique called tissue clearing, where we can process the entire mouse inner ear, make it a little transparent, and observe with a light sheet microscope where we can look at the entire inner ear. And this is just a representative of a whole temporal bone that you're seeing right here. If you compare with these structures, the diagram right here, you can see the cochlea. And then you can also see the vestibular organs. This is the saccule, utricle, anterior, and lateral crista, as well as the posterior crista here. This was, by the way, labeled with myosin 6 antibody and phalloidine. So this is a representative image of a, this is the mouse 39, which was just a mock PBS infection. Let me show you what it kind of looks like. So you can clearly see the hair cells, and you can also section these in the computer and the light sheet microscope, and the tissue clearing is a very powerful tool when you want to see things in 3D. And this is a mock compared with a infected mouse at 10 days post-infection. This is a mouse that actually died at 10 days because of the severe acute phase of the disease. And the green is again where the hair cells are. You can see that there's not a lot of change at 10 days when during the acute phase. You can see the vestibular organs here also. But once these mice reach the convalescent phase, this one was CD8 depleted and 90 days post-infection. This is the cross-section of this sample, actually. And you can see that the hair cells are pretty intact even after 90 days. And you see all this change with hemorrhage and also the degeneration of the spiral ganglion and the cochlear nerve. But if you look at the organ of Corti, you can see that the hair cells are pretty intact. So to summarize study number 2, we found out that the CD4 T cell depletion was associated with acute severe Lassa disease, while the CD8 depletion was associated with hearing loss. So there seems to be 2 different things going on with the T lymphocytes. And then pathological changes that we saw were in the cochlear nerve, hemorrhage to the vascular rich tissue, and the lymphatic hydrops, edema, and fibrosis in the lymphocytes and in the perilymph. And we also saw that the sensory hair cells were mostly intact. And the Lassa virus and the CD3 positive lymphocytes were observed pretty much in the same region. And we also confirmed that immunologic response was indeed necessary for Lassa virus infection and induced hearing loss. We took this a little further with the clearing. This work was done with my very talented postdoc, Marina Saito. And what she did was she labeled the whole cochlea with the Lassa virus antibody. When we first started the study, there was not a good Lassa virus antibody, but now we have a pretty clean one commercially, so we started using that. We also wanted to see what the neuronal structures look like at different phases of the disease. And this is just a representative of whole cochlea where you're looking through the nerve bundles in the internal auditory canal region. So you see the bundle of the cochlear nerve going into the spiral ganglion area here. And you see a pretty big blood vessel crossing that area. And what I want to point out is that looking at these structures, neurofilament is of course staining all of the nerve bundles, but you see these little dots, which is the Lassa virus that seems to be associated with the blood vessels or the tiny blood vessels that are surrounding the nerve fibers. And sure enough, we stained the whole nerve bundle with NFH. This is neurofilament heavy chain. And also with CD31, this is a marker for blood vessels. And the green is Lassa virus, the Lassa virus particles. The upper panel here is from 8 days post-infection. The middle is 35 days post-infection, but this animal did not have hearing loss or balance dysfunction. And then the lower panel animal had hearing loss and balance dysfunction. And so we're comparing these 3 time points and also the symptoms of these animals, and then the 2D H&E and also immunohistochemistry results are on the right-hand side. So when we look at the early stages of the acute disease, we see the Lassa virus mainly within the blood vessels and not really aligning with the neurofilament. But then later on in the disease, now you see that the Lassa virus staining is pretty much co-localized within the nerve fibers, but then they're not in the blood vessels anymore. And comparing the ones without disease, without inner ear behavior dysfunction, and the one with inner ear dysfunction, the ones with the behavioral dysfunction has more Lassa virus within these structures. And this is also shown with the immunohistochemistry with the paraffin sections. This time, the red staining is where all the Lassa virus is. And you can see that at the acute phase, you don't really see a lot of staining with the Lassa virus marker. But then as they get to a more convalescent phase, you see a lot more within the spiral ganglion. This is just to show you that the hair cells are intact after 35 days. And so is the vestibular tissue. So if you look at this middle panel here, the control animals, you see the beautiful 3 rows of outer hair cells and inner hair cells. After 7 days at the acute phase of Lassa infection, you don't see any destruction, but at 35 days also the hair cells are intact. So to summarize the tissue clearing study, we observed the Lassa virus within the blood vessels in the acute phase, but then in the convalescent phase where the inner ear dysfunction appears, most of the Lassa virus is located within the neuronal structures, and we also saw destruction, regeneration of the neuronal structures. Okay, so then, so what are the next steps? We want to find out if what we found in the mice were actually true with the humans. And what we know about Lassa virus and hearing loss in Africa so far, in the literature, is that the Lassa virus seropositive rate in West Africa is about 9% in the general population. In Nigeria, it's a little higher and 20% or higher. Liberia, 4 to 40% in the hospital staff. Sierra Leone, about 8 to 52% in the general population. In terms of hearing loss, there was a pretty extensive study done in the 1980s and 90s. And this is the basis of why we came up with this number of 25 to 30% of the Lassa fever patients develop hearing loss. And interestingly, for those that develop sudden hearing loss in this region, about 80% are seropositive. So we teamed up with a university in Nigeria to do our human cohort study, which is ongoing right now. Jos University Teaching Hospital, they have a department of otolaryngology. They have otolaryngologists and also one audiologist, which is pretty rare for this region. And we have been collaborating since about 2015, so almost 10 years. Nigeria is the largest economy in Africa. And lucky for us, the official language is English, and so we don't have much of a language barrier between us and them. The capital is this place called Jos is in Plateau State in the center of Nigeria, and it's the capital. The population is about 900,000, and it's 6th in Nigeria. And this is the picture of their teaching hospital. And as I mentioned, they have a department of otolaryngology. They even have a temporal lab. And they see a lot of patients with hearing loss, up to about 250 patients per year. And they fit patients with hearing aids. They've so far done cochlear implants. It's not 3 patients. I have to update this, but quite a few. And their department is pretty robust with 5 faculty members, 9 residents, and 1 audiologist. And this is just the WHO report on hearing. And as you can see, around the age of 60, you will see a lot of the prevalence of hearing loss increases dramatically. But if you look at it, the prevalence rate is about 8.4, about 10% in up. And before age 60, there's not a lot of hearing loss. This is sort of what they see in Jos University Teaching Hospital within their otolaryngology department of patients that come in. And there's just looking at this, so much hearing loss compared to the rest of the world. So their claim that there's a lot of deaf people and it's causing a lot of problems for everyday life seems to be very real for them. So then for us, what we are really interested in looking at it at the with the collaboration with the people in Nigeria is to look at the natural history of Lassa fever and see like the onset and how the hearing loss progresses or develops within these patients. If we can trace that, that would be very good for us to look into the mechanism and characterize the hearing loss. Also, because we know that a lot of the people who come in with hearing loss are fitted with hearing aids and also with cochlear implants, we thought, well, we do know that with the mice study that most of the damage occurs within the cochlear nerve, and we thought maybe we can compare those with or without Lassa virus infection, whether the word recognition score might be a little worse in the Lassa fever patients. And so this is our study design for our cohort and also for the word recognition test. So we wanted to identify newly infected, new onset Lassa fever patients and then trace them periodically until they develop hearing loss or not. But remember, it's only about 25 to 30% that develop hearing loss, so it doesn't mean that all of them will develop hearing loss. And then we also collected a group of people who had definitive Lassa fever in the past and have survived that. And we wanted to know from them the history to figure out the onset and the degree and so forth. And in the second group, we approached from starting with people who have hearing loss, the hearing aid users and the cochlear implant users, and then look at their status of Lassa virus antibody seropositivity. And as much as possible, we are trying to do like audiograms, ABR, DPOAE, and word recognition test periodically and follow up. But of course, because of the infrastructure and everything, it is very challenging. So this is our preliminary results for the cohort study. Group 1A is the new onset Lassa fever patients. So far, we have 22 that were newly diagnosed. All of the subjects had normal hearing at enrollment, and we are still following up with serial audiograms, but the follow-up doesn't always happen, and that's one of the very big challenges right now. On the other hand, Group 1B was the one that had a history of Lassa fever. And we found out that about 70% of them actually have hearing loss. And from the questionnaire, their reply was that the hearing loss was sudden onset around 3 months to 1 year after the onset of Lassa fever. And with the 2A and 2B, the hearing loss patients or the subjects that came to the clinic, we found that among the hearing aid users, 51% were actually positive for Lassa virus antibody. And then for the cochlear implant users, it was up to about 83%. When we look at the normal control subjects who do not have hearing loss, just random people in the same region, the positivity rate of Lassa virus antibody is still very high at 17%. So we are making progress very slowly, but there are some very interesting findings regarding the human study also. This is just a graph to compare the new onset Lassa fever patients on the left-hand side, and then the history of Lassa fever. And as you can see, the pure tone average here plotted the new Lassa fever patients because they're early on in their onset of the Lassa fever. Most of them just have normal hearing, whereas the ones that have history of Lassa fever have various hearing. And again, about 70% of them had hearing loss. So for the entire study, the conclusion is that with the mice studies, Lassa virus infection causes hearing loss in humans and mice after the acute phase, within the convalescent phase. CD4 T cells play an important role in the Lassa virus infection-induced hearing loss. CD8 T cells are critical for pathogenicity in the acute phase. And it looks like the Lassa virus spreads through the blood vessels, but then the target seems to be the neuronal structures at the end. And with the human studies in West African countries, the hearing loss is indeed high prevalence, and so is the Lassa virus antibody titers in this region. And with our cohort, we were very surprised that the antibody positivity rate was up to 50 to 80% in those who had hearing loss. In future directions, what we're working on, we're using these mice models to look at different vaccine candidates, whether they're effective, but more importantly, whether the vaccines develop hearing loss or not, because you can prevent the disease, but if you're creating hearing loss, it doesn't make sense. So we're kind of working on that. Also, if we can suppress some of the immunologic responses early on in the disease, can we prevent hearing loss? We will be looking at different types of treatment that is available with the group in Nigeria. This is a long shot, but can we obtain cadaver temporal bones to study the inner ear pathology in humans? And also, I didn't mention, but the frequency of people getting hearing loss is about 25 to 30%, but they also develop balance dysfunction, and this can be up to 50%. So we're also looking into the vestibular system for our future directions. And that's all for my research presentation, but I want to thank everyone that is involved in this study. My lab, Passler Lab, within UTMB, the GNL, Galveston National Lab, and also the group in Nigeria. And we have been working together for the past 10 years. We have so many people who are involved. And we're very grateful that we are funded by NIH. Hopefully that will continue. But that's all. Thank you.